JFCS. My name is Dr. Mark Ingerman. I'm Chief of Infectious Disease and Infection Prevention at the Mainline Health Hospitals. We're involved in a pandemic right now, and it's been for over a year. And the way out of this is vaccination, so I encourage all of you to get vaccinated. There have been 3 vaccines that have been granted emergency use authorization. They're not FDA approved, but they've been granted emergency use, which is necessary. There are 3 vaccines, 2 messenger RNA vaccines, one from Pfizer and one from Moderna. And these require 2 shots. After the second shot, 2 weeks thereafter, you're fully immunized. These vaccines are incredibly efficacious, 90 to 95%. The other, 3rd vaccine is a Johnson & Johnson vaccine. Again, this is 1 shot rather than 2. And 2 weeks after your shot, you again are fully immunized. This vaccine in the United States was about 72% efficient, but this was tested under much more rigorous conditions. So don't be fooled by the lower efficiency rate as opposed to the others. This is an excellent vaccine. So how do these vaccines change our lives? What can we do that we haven't done before over the last year? Well, first I'd like to state that there's a concern that there's rising numbers of cases in various states. Michigan, New York, New Jersey, Florida, and Pennsylvania. So even with vaccine, we need to be cautious until we break this cycle of the 3rd or 4th phase of this pandemic. It's hard to say whether it's 3rd or 4th. So what can you do if you're vaccinated? Well, you're significantly protected. So if you decide that you want to gather in a small gathering with family members that are vaccinated, so be it. If you want to take your mask off while you're eating, that's fine. What about visiting with unvaccinated people, grandchildren? Well, you are protected, but again, I would stay cautious, and if ever anybody is symptomatic, please have them masked or avoid them coming into your household. So again, these vaccines are excellent, but they do not give everybody a free card to go back to life as known prior to the pandemic yet. Once we have vaccination of herd immunity, which means you either had the infection or you had the vaccination and there's a high level in the United States, we'll break this pandemic. What about exposure? What if you've been vaccinated and had an exposure to somebody that has COVID-19? Well, if it's a minor exposure, not prolonged, you do not need to quarantine or get tested. However, if you have a household contact or co-inhabitant that has COVID-19, and even though you're vaccinated, you should contact your doctor. Other issues, what about travel? Well, the CDC's policy is still against international travel. There are many countries that are having this 4th phase of pandemic, so going outside the country should be avoided. How about travel within the United States? Well, if you do it safely, go to visit relatives, stay in small gatherings, it's acceptable. So what to advise regarding a vaccinated person? Well, don't let your guard down. 1, when you go out in public, please wear your mask. 2, wash your hands. 3, social distancing. So these are very important issues. Don't go to medium and large gatherings. You saw on CNN what happened in Miami Beach. Well, these young people are going to bring the virus back to their parents and grandparents. So avoid large gatherings. If you're going to gather, please gather in an area that's well ventilated. Outside, more so than inside, would be advocated. So again, the vaccines are excellent. They are safe, but they are not a free pass yet. So until we have a huge amount of people vaccinated, and we're getting there, we still have to have precautions. Thank you.